Hello, I'm Dr. Dudley Harris. I'm the founder of the San Antonio Eye Center. I'd like to introduce you to my good friend and colleague, Dr. David Abrams. Dr. Abrams began his professional career with a degree in engineering, but then he moved into the medical field and obtained his medical degree from Thomas Jefferson University in Philadelphia. He then obtained his ophthalmology residency at the New York Eye and Ear Infirmary. Dr. Abrams joined our practice here in San Antonio in 2006.
Hi, how are you? Good morning.
Good morning.
How are you doing?
I'm well, thank you.
All right, welcome. I'm Dr. Abrams.
Nice to meet you.
Nice to meet you. Let's see, it looks like we need to check your eyes for the diabetes today.
That's what my doctor sent me for.
All right, well, let's do that. Anything else we need to look at today?
My right eye is a little blurry when I'm reading.
Okay. Let me have the restriction right up there for me. And just look straight ahead. Okay, we're all done. You can go ahead and sit back. I'm just going to take a minute to get my notes in the chart and then we'll go over some things.
Okay.
Okay, well, all good news. There's no damage in your eyes from the diabetes. I would suggest that we check you once a year, and the most important thing is to try to keep your blood sugar controlled.
Okay.
I'll be sending a letter to your primary care doctor, and then as far as the blurry vision in your right eye goes, it does look like there was a slight change in your glasses, so I'll go ahead and get you a new prescription.
Okay.
Do you have any questions at all?
I don't think so.
All right, very good. I will see you in about a year then.
Okay, thank you.
You're welcome. Nice to meet you.
People are often curious to know how a doctor chose to become a doctor in the first place, and how the doctor decided to become an ophthalmologist or what specialty to go into. They're also curious to know, how does a doctor keep up with the field that he or she has chosen? How do they study? Can they speak Spanish? And what do they feel about the practice of medicine? In this video, you're going to hear the doctor talk about those questions. And you're going to come to know who this doctor really is.
I became interested in medicine actually before I even knew it. I have a picture from when I was a very young child where I was examining a doll with a stethoscope. And throughout high school, I was always good at science and math, and I decided to go into engineering because of the $6 million man at the time. But I made sure that I covered my options, so I went to a school that had pre-med as an option within the engineering program. During college, I ended up working in an emergency room in a hospital one summer and found that I enjoyed that much more than engineering, so I decided to go in that direction. And here I am. As a child, really the only doctors I was exposed to were general doctors and ophthalmologists, and I always had ophthalmology in the back of my mind as a potential career. And then while I was in medical school, my medical school was associated with Wills Eye Hospital, which is one of the best ophthalmology programs in the country. So I was fortunate enough to be able to do a few rotations there as a medical student, and found that I really enjoyed being able to diagnose things fairly quickly and being able to fix a lot of problems without having to do a lot of tests. I like to keep up with ophthalmology in several different ways. I read journals on a weekly basis. I also do some online courses. And then every year or two, I like to go to our big national meeting where I can take courses in different subjects that are of interest to me. I first learned Spanish during my residency in New York City. Probably about half of our patients didn't speak any English. And after about a week of that, you were really happy when a patient spoke Spanish, so you don't have to try and find a Russian or Vietnamese translator. And my Spanish is fairly good, and patients appreciate that I have a good accent. I became involved with medical missions while I was the chief of staff at a hospital in Montana that I worked for. I took several trips with our CEO and several administrators to both investigate how other hospitals were doing their missions and then to set up a mission of our own. We ended up doing a mission in a small town called Tula, which was up in the high desert in Tamaulipas. The local community was generous enough to let us use their hospital for a week. I ran the eye clinic, and a colleague of mine did cataract surgery. And then once I had enough cases for her for the rest of the week, I volunteered to help the general surgeon do hernias, among other operations. And I had a real appreciation for what they did, because my feet were killing me by the end of the week. And I was really appreciative that in eye surgery we get to sit down most of the time. We get to see a large number of diabetics in San Antonio. Generally, we'll see about 50 patients a day, and depending on what office I'm in, it'll vary between, I would guess, between 60 and 90% of them are diabetics. And my approach is to try to be proactive. The best time to treat damage from diabetes is before patients notice a problem. So I always try to stress patients to have regular eye exams, and then if we start to see the beginnings of damage, we may start seeing them a little more frequently. And then if we can catch the disease before it's affected their vision, most of the time people do very well with the treatments. I was thinking about some of the more rewarding things I've done in my career, and it's not the big trauma cases or patients with disastrous eye problems. It turned out to be a very simple thing. I had a family, so a young mother with 5 or 6 children that she homeschooled, and one of her kids I started seeing when she was very young. She brought her daughter in because one of her eyes was crossing, and I was able to find that the kid was very farsighted. And I put the kid in glasses and ended up following her for a period of 10 or more years. And I remember very distinctly when I decided to leave Montana, she said, you know, I just want to tell you that you changed my daughter's life. Just by putting her in glasses, I noticed immediately her whole interaction with the world changed. So oftentimes it's some of the little things that really can make our day. I feel my duty as a physician and ophthalmologist is to listen to the patient and find out what kind of problems they're having and what concerns they have, to examine them so I can figure out what the problem is and then hopefully be able to fix it for them. Take great joy in being able to fix the problem for the patient and have us both happy.